Hi everyone, my name is Kelly Griffin, and today I'm going to be talking to you about skin cancer. So, skin cancer runs in my family. My parents have had it, my aunts and uncles have had it, my grandparents have had it as well. And that's why I picked this topic because it's something that I'm sort of familiar with, but I wanted to know more about since pretty much everyone in my family has had some form of skin cancer at one point in their life. So, what is skin cancer? Skin cancer is when the cells that make up your skin and the tissues of your skin grow abnormally. So, they could grow much more rapidly than your regular skin cells, or they could grow in different shapes and sizes than your regular skin cells, and they can cause tumors on your skin. And about 20% of people are going to develop skin cancer in their lifetime just due to being exposed to UV radiation from the sun. And so there are different types of skin cancer. There's actually three kind of main types of skin cancer, which are squamous cell carcinoma, basal cell carcinoma, and melanoma. So, squamous cells are flat shaped and they make up the surface of your skin, they make up some of your organs that are hollow, like your kidney, and they make up your respiratory and digestive tracts. So squamous cell carcinoma sometimes has exposed sites on the skin, as you can see in this image, and they grow or they form in a much lower density than other types of skin cancer, such as melanoma or basal cell carcinoma. And it's rare for people who are not Caucasian to have squamous cell carcinoma or really any type of skin cancer just because of the um, different pigments that is made up that makes up our skin. And so basal cell carcinoma is the most common form of skin cancer. The number of cases increases by about 10% each year, again, due to the fact that we're exposed to more UV radiation than in the past. So, the most common place for basal cell carcinoma to show up is on your head, your neck, sometimes your chest and shoulders as well. Um, and as you can see here, there are small lumps, and it just kind of looks like a spot. And it usually like forms and grows pretty slowly. Um, and sometimes basal cell carcinoma can go through a cycle of scabbing and bleeding. So it starts out as sort of just a small spot, sort of like this, and then, like, if you just happen to scratch it or something touches it the wrong way, it can start to bleed and then scab over, and it almost becomes sort of like a scar. And then people who have basal cell carcinoma are at a much higher risk for developing other malignancies, such as squamous cell carcinoma or again melanoma. And so melanoma is the rarest type of skin cancer, but it's also the most deadly type of skin cancer. And as you can see, it looks much different than the squamous cell carcinoma and basal cell carcinoma. Um, as it's kind of black and brown. Sometimes it starts flat, as you can see right here, or it can be even a mole. And so melanoma only accounts for 2% of all skin cancer cases in the world, but that number is slowly increasing again due to UV radiation exposure. And about 5 to 10% of all melanoma cases are inherited genetically. So if your parents have it or someone in your family has it, there is a slight chance that you could get it just because it's in your genetics. And the most common places for melanoma to form are on your chest, back, and your legs. And again, they can show up as just something that looks as minor as a mole, but you always want to, even if you have a mole that's dark like this, you're always going to want to go to the dermatologist or doctor, get it checked out just to be safe. And so their most common treatments for people who have skin cancer are Mohs micrographic surgery and cryotherapy. So Mohs micrographic surgery is the top notch for removing skin cancer. And so first the tumor or the area where the skin cancer has formed is given an anesthetic, which is usually some sort of numbing cream or numbing shot, depending on how big the tumor is. And after the tumor and the area around the tumor are numbed, the skin or the tumor is removed from the surface of the skin. So they usually do this with a scalpel, and they go in and they'll just cut it off the top of your skin. If it's a little bit underneath your skin, they'll go in and take that out as well. Then they make sort of a map or a guide of that skin tissue in that area where they took the skin off, or where they took the tumor off from your skin. And with that, they take, say you have a freckle that was near the area, they keep track of where that is on your skin. So if they have to go back and remove anything else from that area, they'll know exactly where to remove it. And again, if the skin cancer returns to that area, they have that map to go back and remove any new skin cancer that forms or any other malignancies that might form in that area. And depending on what the removal site looks like after the surgery, the surgeon can go back and sort of reconstruct the skin in that area. They can do that in a couple different ways. If the area is severely damaged, they could do a skin graft, which is where they take skin from another part of your body and put it there to help your skin heal and grow back to the way it should be. Or sometimes it's as minor as just needing stitches. It all just depends on the case and what the tumor looks like. And so the other common form of removing skin cancer is cryotherapy, which they sometimes do if you've had Mohs surgery, and then they can take any other skin cancers off if it comes back and if it's minor enough to just freeze it off. And so the area where the cancer comes back and they're going to freeze it, they'll numb it just because even if it's only cold, it still can hurt you. And they just want it to be much easier to take off. And it's often frozen off with a liquid nitrogen. And so prevention, the best way to kind of keep skin cancer at bay and not get it is you have to wear sunscreen. That's the number one way that you're going to prevent skin cancer and not have any chance of getting it. So you always want to make sure you have something that is minimum 15 SPF, whether you're leaving the house and you're just going outside to get the mail, or if even on a cloudy day, because you can still get that UV radiation through the clouds. And again, you also want to avoid tanning beds because you still are exposed to UV radiation from the lights. And then the best way is going to be staying in the shade whenever possible. So if you're outside in an area where there's shade, you should try and sit in the shade and stay out of the sun as much as you can, especially if you have skin cancer or have had it in the past. You're going to want to definitely put on sunscreen and stay out of the sun even more than you would if you didn't have it. That's my presentation. Thank you for listening.